Let's move back to one of our top stories now. Jailed former Bosasa C-O-O Angelo Agrizzi has been rushed to hospital. And of course, we know that yesterday he was denied bail and he spent his first night in jail last night. Now, Correctional Services Department spokesperson Singabakho Nxumalo joins me now via Skype. Good evening, sir. Thank you very much for your time. Could you tell us exactly what happened in terms of Mr. Agrizzi's health this afternoon?
A very good evening and thank you for having us. What we can confirm as the Department of Correctional Services is that remand detainee Angelo Agrizzi was assessed by a team of our medical experts. Then a decision was taken that he be transferred to an external public hospital where further examination must be done in line with his health condition. It remains critical that all inmates, remand detainees, everyone in our care must be really looked after so that we can ensure that the well-being of that particular person is protected at all costs.
Was this a routine examination or was Mr. Agrizzi in some form of physical distress?
He was admitted yesterday. Some form of an assessment was done, but if a person is being admitted for the very first time, it's important that even the following day you also pay a visit to that person. It's even more critical when someone did register that there is a medical condition and also a letter from his or her doctor. Then our medical team had to pay attention to that. Hence, then even today, he had to be visited by medical experts, and upon examining him, they reached a point that no, he must be taken to an external facility for further prognosis.
What's wrong with him?
Unfortunately, we're unable to disclose the condition that he could be suffering from, but it's something that cannot be taken for granted. Hence, then our medical experts felt that he must be taken to a tertiary institution, which could really give him the best appropriate medical care available.
You mentioned a little earlier a heart condition. We know that he's on oxygen. We saw that yesterday. Is it related to those issues?
It could be related to any other condition, that he might be suffering from, but we cannot disclose the end of that. It will be illegal. That's a matter between, I think, him and his medical doctor. Yes, our healthcare officials will be aware of that, but it's something that we cannot disclose to the public. Will be encroaching on his rights, although he's a remand detainee, but he remains a human being. His human rights must be protected at all costs. All that matters at this stage is that he must be given care that is necessary.
Is he in ICU at this point? Are you able to tell us?
Unfortunately, I do not have such information.
And he's in a hospital. Is it a government hospital or a private hospital?
At this stage, we can confirm that we transferred him to a public hospital, but our policies and procedures do allow that should the inmate, remand detainee, or the family have the resources to say they would prefer that a person be treated at a private institution, that can be arranged, but at their own cost. And those costs will also include guarding services, which must be rendered by our officials. So at this stage, he's in a public hospital, and then we'll just have to monitor the situation. Should there be another need register that he be moved to another facility, we'll have to then follow our procedures.
So I understand that you're not really able to tell us how serious his condition is, but let's presume that he gets well enough to go back to prison, bearing in mind that he's been denied bail. This is a man who's on oxygen. He has obesity. You mentioned a heart condition, and we're living in an era of COVID-19. We know there's a big health risk for obese people with COVID-19. What are you going to do to make sure he's absolutely safe in prison?
The Constitution makes it very clear that any person within our facility must be looked after, must be given the best care possible. Hence, then, it is our responsibility to ensure that we look after him. Hence, then, a decision was taken even today upon examination by healthcare officials that no, this person must be transferred to an external facility where there are additional resources. Hence, then, we are at this stage right now. And he will be there up until such time that the medical experts have felt that he is now fit to be sent back to our facility, and will do that. Fortunately, our healthcare professionals do have a healthy working relationship with doctors in the external hospitals. They are able to share notes, to engage on matters that must be looked into. At the end of the day, life must be protected. Whether you are a sentenced inmate or a remand detainee, life must be protected.
Well, thank you very much for that update. That was Singabakho Nxumalo. He's the spokesperson for the Correctional Services Department, just updating us. Angelo Agrizzi is in a government hospital this evening. This follows routine checks. It was assessed that he should get additional assistance at a hospital.